What is the ideal age for the knee replacement? It's $1 billion question because there's nothing like upper age limit, and previously we used to do the lower age limit was maybe 55-60. Because nowadays arthritis has become very common in youngsters even after 30-40 years. So as such, there is no upper or lower age limit. It's only the severity of the arthritis. If anybody, irrespective of the age, have severe knee pain, deformity, stiffness. In the past, we used to say the first indication is pain, second indication for the operation is pain, the third indication also pain. But now we add deformity, stiffness, and affecting their quality of life. Pain affecting their day-to-day activities, not able to do their activities of daily living, is the best person for knee replacement. And it should be supported by X-ray damage of the knee joint. Sometimes knee pain can happen because of the hip problem or spine problem. It's very, very important. In those people, if you do knee replacement, they will not get benefited.